We live now in an environment of heightened skepticism. I've been approached by people with plenty of questions about the authenticity of coronavirus. We had Dr. Joseph Castaldo with Ohio Health in the newsroom today, so I took a few minutes to ask an expert in infectious diseases just a few questions that have been asked of me. Starting with, is this coronavirus panic completely media-driven?
It's not media created. In my opinion, it's a media job to service their customers, that being the public. So what the media needs to do is help promote safety, help promote statements that come from the CDC, Ohio Department of Health, Columbus Public Health.
There is belief the panic is politically driven.
No, it is not. What is happening is based on science. We are trying to protect the public. My job as a doctor is to protect the public and protect my patients.
Because this virus started in China with 80,000 infections, doctors have a significant case study to predict what we can expect in the U.S.
Approximately 74,000 people. 80% of those 74,000 people had very minimal symptoms.
So why don't we panic, since 18 to 20,000 people have died from the flu since October? Something that happens nearly every flu season.
It's a new virus. That means everybody in the whole world is susceptible to it. The people who are higher risk begins at the age of 60, 70, 80. If you get the viral infection, you're going to be more sick, especially if you have the following health conditions: heart disease, lung disease, diabetes.
The cases identified in the Buckeye State are isolated so far.
We don't have community outbreak yet in Ohio. We will. Is it going to become widespread? How many people are going to get it? Based on what I said, potentially it's going to be a lot. And the people who are going to get sick are those older and with those health conditions.
And as you can see, my interview with Dr. Castaldo 2 hours before it became community spread. First case of community spread announced in Stark County just a few minutes ago. Again, that man not traveled out of the state. He hasn't been in contact with anyone who was tested or treated. Governor DeWine and the experts at Ohio Health Department call this case community spread. If you have questions, call the coronavirus hotline, 833-427-5634.
Senate Democrats are urging lawmakers